For my talk, I don't have slides. I'm just going to kind of give you the nuts and bolts of how I've been able to kind of get my experience or practice up and running. As Jesse had kind of illustrated before, my talk is very, very similar kind of concepts. The idea is that if you really believe in something and you want to push forward, there's always going to be a lot of resistance. My personal experience with, I have a partner as well, Dr. Brambad. Between the two of us, we've done close to about 1,500 robotic microsurgical cases in urology. The kind of cases we do are vasectomy reversals, reconstructive work for congenital anomalies like vasoepididymal obstructions where we reconstruct them. And then also we specialize in chronic groin and testicular pain issues. So patients who have chronic groin pain after a surgery, hernia repair, vasectomy, sports injury, some very difficult kind of patients, and we've identified a few nerves that we think are responsible, and we do something called targeted robotic denervation, where we ligate these nerves. The outcomes are fairly good, and what we found is, as Jesse said, if your outcomes are good and the patients are benefiting, then in the end, I think we'll succeed. It's just that it's a bit of an uphill battle. In urology, just like Jesse was saying, you got to fight with the urologist. We have to fight with the urologist too, because what we're using the robot for is not your traditional prostate or kidney. It's more microsurgery. And so when we started, what I would do is, since our procedures are small outpatient procedures, you don't want to be too greedy. What I would do is negotiate with the hospital and tell them, listen, you've got these you've got the case booked all day for like 2 or 3 prostatectomies. Let me do one of my micro cases at the end. So, you wouldn't get the most desirable operative time. It might be the evening or, late afternoon or early evening. But from a hospital standpoint, it was great because they get more utilization out of the robot. You don't get the best start time, but the beauty of this setup then is that the cost to you is really minimal. On average, Dr. Cavusi's done some really cool work in terms of calculating the average increased cost per microsurgical case is about $200 or $300 for robotic urologic microsurgery cases compared to a standard micro case. And that's assuming you have a robot. Because as Jesse had mentioned, what you had to realize is that once the hospital has a robot, there is a cost that hospital is spending every minute that it's not being used. So you want to make sure that you have maximal utilization. So in a situation where there's a robot, it's really good to think outside the box and come in and, if you're willing to operate in the evenings or on weekends, you have to pick a time or a place where other surgeons may not really desire to use the robot, but that doesn't mean that it can't be used at that point. And sometimes it's great because the crew that you get, the staff that you get, may be more dedicated to or interested in what you're doing, and so sometimes there's an opportunity in every door that seems to be closed. There is definitely still a struggle, even though we've done 1,500 cases. Recently, I was up for my board review, my 10-year recertification, and the urology board was kind of coming after me a little bit in terms of some of the codes I'm using and some of the techniques. So you have to remember that this resistance will come from all avenues, not just direct visual threats. So there is a price you pay in terms of kind of pushing the envelope. But the idea is to be firm, just to be, don't do anything illegal, but as long as you're doing standard of care and you're merely replacing what you do with the microscope and the outcomes are good and you're publishing your outcomes, it's hard for them to really attack you. And all the conferences that we do and some of the talks I gave really came into my defense, and and a few of my friends out there, these colleagues you meet and people you meet actually become very helpful because it becomes your reference network to help fight off some attacks. But another way to look at it is that, if someone once told me that, usually if you're doing something challenging or right, that's when you meet the most resistance. And so my feeling is that, if this really is meaningful and you're interested in pursuing this, it's well worth the rewards. From a financial standpoint, with our program, we've been very lucrative for the hospital because our cases are short and quick and they're outpatient-driven kind of procedures. What ended up happening is the hospital liked our procedures so much that it started to shift where now we're one of the primary services. They actually like our cases more than a long gynecological or prostatectomy case, because that takes longer, uses more resources, and if we can get 2 or 3 cases done in that time frame, then it's a benefit. So from that standpoint, what appears to be a challenge initially may actually be an advantage over time. And so again, the key message I have to say in terms of implementing a program when starting out is, be persistent, and if you really feel it's worthwhile, it is worthwhile. One easy way to start out is, I know it may seem very expensive and challenging to find and try cadaver models. Another option is using synthetic models. There's a company called Syndaver that makes synthetic cadavers and synthetic parts. So when I started doing vasectomy reversals initially, I worked with Syndaver and would send them samples of vasectomy, tissue from vasectomies and from cystectomy procedures that we were doing, and had them reproduce tissue that was just like the vas. And that's what I practiced on. And so that way, there are very innovative ways you can, and the nice thing about using synthetic materials, you don't need to get as much approvals, and you can use it, it's clean and sterile, and so you can use it in the evenings, work on the robot on your own and practice what you're planning to do before you actually do it, and get some good training. So these are just some of the pearls that I kind of learned on the way, but again, I really believe it's worth it, and if there's a lot of resistance, usually it means that you're doing something right. So with that, I'm going to end quickly just so we can get back on track, and unless there's any other questions.